Hi, I am Dr. Vinay Kakkar, consultant orthopedics and joint replacement surgeon practicing in RV Super Specialty Hospital in Gurugram. So this is a story of a 50-year-old woman who hails from a remote West African country called Liberia. She was brought by her relatives to us with the chief complaint of chronic thigh pain and inability to bear weight on her leg. She was bedridden for past 3 years. On checking her medical records, it was found that she suffers from a rare cancer that affects primarily the bones, and it is called multiple myeloma. This cancerous growth involved the complete thigh bone, that is femur, in this patient. Sadly, she was advised hip disarticulation, a crippling below waist amputation surgery by the doctors back in Liberia. It was unacceptable by all means. But the patient and her relatives were disheartened. It was unacceptable by all means. The patient and her relatives were so disheartened. But she came to meet us, and we at RV Super Specialty Hospital in Gurugram offered her a limb salvage surgery. This surgery is called a total femoral replacement. It is a complex surgery that involves excision of the cancerous bone and replacing it with artificial prosthesis that spans from her waist up to her legs, up to her knees. So this involves a hip replacement as well as a knee replacement. It is a very rarely performed surgery. So this was a marathon surgery that lasted about 7 hours, but the results are so fruitful. Our team of anesthetists took great care of this patient. Many thanks to the patient and her relatives for being so calm and supportive during the treatment and rehabilitation.
कम लम्हे होते हैं जब सिर्फ डॉक्टर ही नहीं बल्कि इंसानियत हर जगह से उम्मीद हार चुकी थी। खास तौर पर अब लगातार पिछले कुछ सालों में इनकी जिंदगी को भी खत्म करने की कोशिश कर रहा था, लेकिन इनको एक नई जिंदगी की उम्मीद दी आरवी हेल्थ केयर सुपर स्पेशलिटी हॉस्पिटल गुरुग्राम में। डॉक्टर विनय कक्कड़ जी के बारे में मैं आपको बताना चाहूंगी। इन्होंने बड़ी सर्जरी की है। उस सर्जरी की
जैसे कि आपने बताया कि एक कैंसर की सर्जरी थी, पेशेंट को मल्टीपल मेलोमा था एंड टोटल फीमर इनका डिस्ट्रॉयड था बिकॉज ऑफ द ट्यूमर, इनका राइट साइड का फीमर। और इनको इनके हॉस्पिटल जहाँ ये कंट्री से आए हैं, लाइबेरिया से आए हैं ये लोग, वहाँ पे इनको डिसआर्टिकुलेशन, हिप डिसआर्टिकुलेशन के बारे में बताया गया था।
I operated her in the last week of August. Within 2 weeks of surgery, she was back on her knees and taking small steps with the help of a walking aid. A really commendable job done by our physiotherapy team. Finally, she flies back to her country after a month of her surgery with a promise of continued positivity and strength during her rehabilitation. Her recovery is indeed so remarkable. From being bedridden to walking without support in a short span of 3 months is really surprising. Well, now she celebrated her 51st birthday this December, dancing with her friends and enjoying her new life. I have no words to describe my feelings and satisfaction watching them so happy and so cheerful. We'll always pray for her long life. Thank you.